Hello, we are Libre Lungs, striving to unlock your breathing. I'm Talia.
I'm Corey.
And I'm Scott.
Sensitive content on the next slide, viewer discretion advised. Pleural empyema, a primary cause of lung fibrosis, affects 6 in 100,000 individuals in the United States, where 1 in 5 need to undergo lung decortication. Lung decortication is a procedure that removes the fibrinous tissue layer covering the entire lung, restricting expansion when breathing. Cardiothoracic surgeons are in limited supply of surgical instruments that can safely remove this tissue layer without causing trauma to the healthy lung tissue. Symptoms include difficulty breathing, infection, and chest pain, along with many others. Our clinical need is for thoracic surgeons to have a surgical instrument that is capable of tissue differentiation with better navigation while peeling across the rind of the trapped lung during VATS. Our focus is on the multi-billion-dollar market of thoracic surgery, which has an expected annual growth rate of 9.3% over the next 7 years.
We are working on a laparoscopic device that can separate the fibrotic tissue that traps the lung. Our blunt edge device will have a 360-degree range of motion and will include a tissue sensor that will provide real-time imaging. The goal of this multifunctional device is to reduce surgical procedure time and lower the risk of infection. We will use these target specifications to validate our proposed model. Our model will be to calculate the shear force needed to separate the different tissue layers. We will begin with a mathematical approach followed by lab testing, beginning with peeling fruit such as kiwis or oranges. This will provide us with hands-on field experience to test our concept performance before we take it to murine or porcine models.
Our future directions include physical prototyping and validation of our current photoacoustic sensor. This imaging method includes the use of both light and sound energy for the visual resolution of tissue characteristics. It is able to indicate collagen content, oxygen saturation, and vascular fluid flow to the surgeon. This data will be analyzed to determine the most effective method of scarred and healthy lung tissue differentiation. As most patients undergo MRI or CT imaging for diagnosis of fibrotic lung disease, we will assess the feasibility of combining the real-time data from our sensor with these pre-operative images for use in video-guided surgical procedures. We are also investigating the potential of supplementary treatments involving the application of enzymes and growth factor inhibitors to the diseased lung tissue in order to halt disease progression and degrade scar tissue formation. Thank you for watching and stay tuned for updates on our device.